Up next, we have another power-packed keynote presentation on telehealth utilization in the region, Past and Future Trends by Dr. Najib Al-Sharabji, President, Middle East and North Africa Association of Health Informatics President, eHealth Development Association. I welcome you, Dr. Najib, and the stage is all yours. Dr. Najib, the stage is yours.
Thank you. Thank you very much indeed. I'm really sorry that the electricity has gone off in the area where I live, and I will not be able to share the screen or to use my technology for that. But I will be able to speak and at the same time show my picture at least, unless you want to see the presentation on the mobile phone. So it's a pleasure to be part of this. And special pleasure that I have is actually to be part of the Kingdom of Saudi Arabia Telehealth Technologies Summit of 2022. And this keynote actually is about the telehealth utilization in the region, the past and future trends. And when we talk about the region, we talk about the Eastern Mediterranean region, which is part of WHO region, actually regional setup, and it is made of 21 countries, and it is hosted in Cairo, and Saudi Arabia is an integral part of that. Now, what I will be talking within the coming probably 30 minutes or so is the following topics. Number one, I will be talking about the diversity of the region, including health and ICT profile. I will be talking a little bit on the use of telehealth and telemedicine services in Saudi Arabia. This is one of the areas that are really important in terms of motivation and reality of that. And I will be talking about the telehealth and telemedicine in the region during the COVID-19 pandemic. And then I will be talking about the future trends in telehealth and telemedicine after the pandemic, including the legislation and the IT infrastructure. The region of the Eastern Mediterranean is actually one that is very, very diverse. The diversity is actually the sort of the biggest trend that we can see actually. And that diversity is in the governance and political systems, because we have kingdoms, we have the governance structure in terms of health and in terms of the political system. So as I said, we have kings, and we have presidents, and we have countries that are elected, parliaments, and so on. And then there is diversity in the geography and the climate. We can see actually the desert, and we can see the Mediterranean culture and the environment and the geography ranging from desert to mountains and so on. And then we have the people themselves that have different colors, different traditions, and different things. Although the vast majority of people are believers in Islam and in that religion in particular, but that does not actually exclude the diversity in the cultures and in the people. And there is a huge diversity in the human resources and employment opportunities that exist in the region, where some of the countries, they have much more human resources, at least for health. And the previous speaker has highlighted the need to have human resources, in particular in Saudi Arabia, over the coming few years. And then that diversity has resulted, of course, in the diversity in healthcare systems, where universal health coverage is actually the final objective for many of the countries, but not achieved because of different reasons, because of the way that they are actually structured in that. And of course, the diversity that we can see is in the information and communication technology infrastructure, which resulted in what we call the digital divide in the region. Now, there are countries that have over 100% penetration of the internet, of the mobile phone, while the other parts of the region, we have the countries that are actually less than 2% the penetration of the internet and the mobile phone. So if you want to compare countries that have a lot of infrastructure with countries that do not have, it would be unfair to try to compare these countries in terms of penetration of digital health in their healthcare system, which of course resulted in the digital health diversity as a result of the governance, and as a result of the ICT infrastructure, as a result of the different aspects of that. And that's why we can see actually that there are at least 3 categories of countries in this region. One that has a lot of income, and then there is the middle income, and then there is the poor income countries. So that national income is actually a huge influencer in the way that digital health is being seen and being done. The other topic that I wanted to cover very briefly is actually that we use telehealth in a different way, and we use different technologies, and we use different ways of describing what we have actually, including telematics, telehealth, of course, telemedicine and telehealth are the more used terms. Now, whatever is actually the medical specialty, you can add the word tele, and it actually can fit very nicely. But let's focus on the 2 terms that we are using more frequently, more general, including telehealth and telemedicine. Telehealth, of course, because health is larger than medicine. Then telehealth is different from telemedicine because it refers to a broader scope of remote healthcare services than the telemedicine, where telehealth is actually for people and for the environment and for different things as population, where telemedicine is focused on the individual. So the telemedicine is specifically referring to remote clinical services, while telehealth can refer to remote non-clinical services such as provider training, administrative meetings, and continuing medical education, in addition, of course, to clinical services. So the use of telehealth, I would use it in a more generic rather than specific when it comes to telemedicine and telehealth. Of course, the use of mobile health, mobile phone, is one big area that is actually booming and is actually coming into the being in all countries of the region, and whether it is actually well developed in terms of income, in terms of economy, or less developed in terms of human resources and health sector and so on. But in all cases, the mobile health is being used, and many countries, actually many individuals, they are using the mobile phone as a way to access healthcare services, using the mobile, or using the telehealth and telemedicine services, including education, including even diagnosis, data collection, which has been a huge topic that we are trying to cover, because the mobile is being used as a data collection tool, especially with devices, especially with remote access, especially with certain devices that are implanted in the body or on top of the certain things. So the use of mobile phone is actually enhancing the way that we provide telehealth services and telemedicine services in the region. Now, the difference between telehealth and telemedicine is actually, as I said, one is for the population, including, of course, the radiology and the telemedicine services, clinical medicine, and all that, in addition to other things. But both would allow the exchange of information and data between clinical professionals, scientists, and experts at national and international level. So that is in both telehealth and telemedicine. They both actually assist in holding distant consultation by real-time examination of diagnostic pictures. They both interactive management of patients' medical records, and medical record is a huge cornerstone and very important in the way that we see telehealth and telemedicine services. They provide both distance consultation, diagnosis, treatment by medical specialists. They are the availability of quality healthcare in remote areas in the country. They're both providing that. They improve the qualifications of national specialists if they are properly used for education purposes and for continuous medical education in particular, second opinion, for example, the overall improvement of services by centralization of resources. So you don't have to have resources, human resources and equipment and devices in every single hospital or every single healthcare center. You can have that in one place, at least in that geographic area, while the different people can actually have access to that particular resource. They can provide effective and efficiency management of action, and of course they are both cost effective in education and in the way that we provide healthcare services. Now to zoom in,
Dr. Najib, sorry, we're already running out of time.
I will finish in less than a minute.
Okay.
In Saudi Arabia, the use of teleeducation and telehealth is booming a lot, actually. In fact, in 1998, we did have, when I was in WHO, we did have the first regional conference on telemedicine, and that was in King Faisal Specialist Hospital in Saudi Arabia. And from that time, actually, the interest in the subject was huge, and the interest in the topic was actually booming a lot. Between 1998 and now, a number of institutions, a number of healthcare centers have started to do so. The COVID interest in the East Mediterranean is actually focusing on delivering of healthcare through remote sensing, through remote areas, through the remote access to diagnosis. And then the regional office of WHO actually issued its document on the need to develop and to do that. And in that document, actually, they have mentioned health information management and surveillance, in which they said actually streamline the use of information communication technology infrastructure for platforms for COVID-19, for the management of that. And of course, when they talk about information technology, it goes without saying that the telemedicine, telehealth services are covered by that. Now, the idea is actually to have development of national digital health strategies. If we are going to go forward, this is the last thing, development of information and communication technology infrastructure, especially in hospitals, in healthcare centers, and of course, development of more resilient healthcare systems, development of legal and legislative frameworks, including the ethical part, and of course, what has been done in the United Arab Emirates, in Saudi Arabia, in a number of countries in the region, actually, in terms of having education programs for the telehealth and for health informatics in general, is something that we do commend. And the other thing is actually to try to influence, and this is coming actually because a number of countries are introducing laws and introducing ways in which the insurance companies are accepting telehealth services as part of the provision of healthcare services. Now, I finish with this, and I'm really, again, I'm sorry for the lack of the technology because of the cut in the power supply that we have. So I'm using my mobile and, of course, the telephone and the presentation itself. So back to you. Thank you.
Thank you, Dr. Najib, for your valuable insight and thoughts that you shared with us today. Do enjoy the rest of your day.